Hi guys, this is a video of your feedback on your papers that you wrote some time ago. I am using a new program called Camtasia and I hope it works. So it's basically recording my screen and what I click around and what I do. So looking over your papers, I identified 15 or 16 things that are very common throughout everybody's paper, and I was going to go over some examples of how you guys did these errors and where to improve. So let's see if I can get it to move forward. Okay, here we go. Some of the main errors that I saw in everybody's papers were header errors and or title page error, informal use of words or language, run-on and comma splices for your sentences, a lot of redundant terms, non-essential words. I can give some examples in a little bit. Statements presented as facts. Always important to cite your things that you found. The opinions, a lot of people put their opinions in there. There is literal language, or excuse me, there was a lot of figurative language, such as infection rates skyrocketed, and we don't really say skyrocket. We have to be very literal when we write scientific papers. There was a lot of incorrect text citations. You know, I got to give it to you. This is your first run at writing this type of paper, but we can fix that. That's not so much an easy fix, but we can definitely look in the book a little bit better. Many people address the readers, or they were speaking from first-person narrative. So I'll give some examples of that. Introducing abbreviations, we can't just say MRSA, or we can't just say CDC, we have to spell it out first. There was a lot of vague and confusing pronouns, that and this, they, I can show you examples of that. The reference page, a lot of different deviations of what the reference page is to look like, and then many people started a paragraph with a quote, which is something we don't do. So let me go ahead and bring up a paper. Okay, this is some different examples of the variations and errors, the variations in the title pages and the, what do they call it, headers up there. So officially, you should start like this, running head, infection prevention. This student bolded it. It should not be bold. All of that should be caps, and it should be to the left side of the screen. Here on the first page we didn't have running head, and here we had running head. However, it is in the center, and the student did not right here capitalize everything. So that should be caps. It should be to the left. It should not be bolded. This is probably the closest one. This student didn't have a page number here. And we need three things when we write papers in the nursing program. Your title, oh, where's my mouse? Here we go. Your title, your name. I took the students' names out right here. These students allowed me to use their paper as long as I agreed not to tell who it was. So you need your name right here, and then the third line is going to be University of West Florida. So this one student had a pretty long title. It should be less than, I saw two places in our APA book. One says 21 words and the other one says 14. I'll just tell you right now, Dr. Garrett does not like a very long title, so the shorter the better for her. I know that from grad school. And you wouldn't have here a College of Health. Nothing needs to go on the bottom. This should be centered in the upper third of the page. This one's a little bit kind of low, so it should be moved up. This one's probably good, and that one's good as well. So, moving through somebody's paper, I actually did some arrows. Let me go to a different page. Bear with me. Okay, this is the first one and probably easiest one to get a lot of the examples off of. So, as you can see, there's the bold that I talk about. It should not be bolded, and it should be the same kind of font of this one. I think there's a difference here. This one might be Times New Roman, and this one I'm not even sure what it is, so if you can, make it the same. It's not a deal breaker though, but it should be the same. So this student opened up with a very good line. However, our next one, it says, in this video, or in the video, we are shown a young, healthy college student. Whenever you do papers, they should be written not addressing anybody. Here we pulled the reader into the paper, so you're saying you and whoever is reading the paper. You don't say we, you don't say you, and you don't say I. Kind of like your textbook. You know how you read your textbook? It's very non-personalized, matter of fact, it's sort of dry and it lacks personality. That's what you have to have in your papers here. So it should have say, or a better way to say this, in the video, you know, a college student had, well, I don't know if I could say the student sentence. I probably would have just deleted it altogether. But anyway, anytime you see we're or you or I, it's got to go. Right here, a lot of life before her. That is an informal use of words. It's something that we could say in conversation. It's extremely cultural dependent. If I were to go to Asia and if I were to say, you have a lot of life before you, they would have no clue what you mean. You have to be, in these scientific papers, very blunt. So a college student is young and is expected to live a long number of years, something along those lines. That is more descriptive and more technical than a lot of life before her. Let me see, the next thing is this line here. She had so many things to look forward to, and because of the series of medical mistakes, all of that is just gone. That is a very vague pronoun, so we have to be careful when we say that, this, those, or even it, just because I'm not sure of what that person is referring to. And your reader, excuse me, not so much me, the reader is not sure where you're going. All of that is just gone. Once again, just gone. Where did it go? You have to be very literal and not figurative whenever you talk about nursing or scientific papers. Let's see. What the video did not show us, another us, got to leave that out. Let's see. Overall, I think this person had a pretty decent start, minus a few errors right up top. Let me go back down here. I encourage people to, and I made notes on y'all's papers, to actually read somebody else's paper for this common conversation talk that people have when they put in papers. For instance, but there are also many ways to stop the chain of infection in its tracks. Because we're being literal, this just won't work. So stop the chain of infection in its tracks. It should be something along the lines of, but there are also so many ways to prevent infection transmission, period. So take that personality out of the paper by not saying comments like that. Let's see. Here we have introducing a topic. Now, I know what MRSA is. General public does know what MRSA is. However, anytime you have an abbreviation that may not be as common, so the golden rule is that you actually start out saying methicillin-resistant Staphylococcus aureus, and then abbreviations right behind it, MRSA. So that's how you would introduce that. Then the rest of the paper, it's okay to actually say MRSA, as long as it's introduced first. And then okay, of course, we're only human after all. That's sort of a opinion, and when writing, you could say, I mean, the line before it once again brings the reader in, are we still going to make mistakes? It probably would be better to say Mistakes are, I'm trying to think of a good word, not function of humanism, but mistakes are a natural cycle of being human, and that is a more better way of saying it. Hey, I'm the teacher, I can say that. Let's see. Moving down here, the biggest point I want to hit on is hand hygiene and using clip properly. Another way to say this is a significant issue, or a significant prevention method for disease transmission is hand hygiene and using gloves properly. So if you had somebody specifically read your paper for just common everyday language, the fancy word for that is colloquialism. So if you had somebody read for colloquialism, then you may have been able to avoid a common error such as that. I think that is on page 68 in your APA book. That kind of talks about not using jargon, not using the common man's language called colloquialism. Yep. So there we go. Big quotes are not encouraged. In fact, this probably is, let's look here. There's something in here I can find word count. There we go. 37. That's kind of high. In fact, your book even specifies how many words should be a quote. Generally, like 25 I would max out on. Any more than that, then you need to restate that person's comments or refer to it, but in your own words. The big thing in nursing school is we don't just want to see that you can copy and paste a really cool comment. We want to see that you can take this information, get from it what you need, and then restate it in your own words. Let's see. Here, ABHR, because that wasn't introduced, I'm not really sure what ABHR is. Nope. So you know, because you read the material, that's why it's important for me to have you introduce it first. Let me flip the page here. Okay. These kind of statements, that should not happen, and we notice something, and if we notice something that could potentially spread infection, it needs to be cleaned as soon as possible. To say that should not happen, what is a better way that we could say it? It is better if we speak up and clean surfaces as soon as possible, something along that lines, instead of saying that should not happen. Once again, refer to your textbook and look how dry and how things are worded in that way. Not so much these matter of facts of kind of feeling a little preachy. Another big issue needs to be following procedures and protocol correctly. So anytime you want to use big, literally you can just slap in the word significant and some of the synonyms for significant. That is a little bit better. Big is too easy of a word. It's kind of like third grade reading level. You guys got to kind of increase your vocabulary, and these small, little, big, good, great. I've seen a lot of folks use the word good in referring to something like, it is good if you blah, blah, blah. Okay, it is, good is too shallow of a word. Same for great and same for big. So you need to kind of figure out a, not more adult word, but a word that has depth to it. The new nurse did not want to gown up again. Right here, Gown up again, that's something we would say in conversation. The appropriate, I mean, that's like medical slang. Nobody, you know, I keep having to think of my friends in other countries. So like people in Europe, they would say gown up. Like what are you gowning up versus gowning down? So you would say use PPE, personal protective equipment. The more specific you are, the better. That's probably a pretty common feeling. Once again, what is that referring to? And probably a pretty common feeling. That's not science. Not because I'm talking about feelings, however, you're assuming this. You can't assume. You have to back your stuff up with facts. If you want to say, you know, that's a common feeling, you need to say where it came from, because if not, you're basically writing a blog post. And nobody in science respects those who write blogs that doesn't have science to back it up, because that's all it is opinion. You're right in your own eyes. So stay away from statements like that. That's probably a pretty common feeling. Not just the way that the student worded it. It's more along the lines of its opinion. So if you got an opinion, you can state it, but you have to back it up. So this is a common feeling. And then I got that from this reading because they tested it and they know. Let's see, down here, ending sentences in preposition. A lot of you guys did that. You used of or with. So to say this, you have to rephrase. If you feel the need to use this sentence, you have to reword it. You can't end with of or with. So it's incomplete. There's no way around it. Let's see. I'm going to go to this back part. Let's see. References. This is good here that the student titled it with references. The only thing wrong is that it's not bolded. These need to be in alphabetical order, which the student did. However, do you see here, this is the published date. Several, not just several, but many students actually who referenced the fundamentals book, they put 2016, which is the copyright date. So this person has a copyright on this book till 2016. I don't have the book in front of me to see what the date would be, but you have to dig a little bit more. I think it's probably like 2014 or 13 that it was officially published. Partnering to Heal, that is the name of the video. When we put the first thing that should go here is the author of it. And the author was these folks, not health.gov. Let's see if I have it still pulled up. Scroll down. These guys. The site is coordinated by the Office of Disease Prevention and Health Promotion. So you can either put them or the Department of Health and Human Services. Those are the folks who authored this. Not Partnering to Heal, because that's the name of the video. So that could have changed a little bit. They didn't have a date of when this was published, so officially it would say N period D period for no date. And then that's when you would say probably Partnering to Heal, retrieved from, or retrieved on, I don't know what she has here. He has here, September 27th, 2015 from blah, 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 blah. This looks pretty good. And then this again, World Health, I need a date. When was this retrieved from? So that's what we have on that student. Let me do that. If I'm good, thank you. We'll do that one last. Okay. I actually, as you can see, made comments on this one. Some I hand wrote, and some actually done on the computer. Let me flip to it real quick. Okay. I did not specify in my directions about this being a summary or more of like a literature search on how to prevent infection. That was the goal, that you would actually do a literature search and figure out what is out there data-wise and how to prevent infection and promote healthy people. However, more students than not actually did a summary. So I am not taking off points for folks who did summaries. Little learning lesson for me about being specific in my directions, because some people did and some didn't, and I can't fault you for it if you interpreted my vague directions one way or the other. So once again, we see this needs to move over, and your second page does not need to have running head on it. So for your first title page, yes, running head. For your next page after that, it just needs to say asepsis and infection control in all caps. Let's see. This one was pretty free of major errors. I see MRSA. Let's see if that person introduced MRSA. So once again, before you start saying acronyms and abbreviations, you got to introduce them. I got stuff here on the second page. Okay. Go down this way. Once again, we have an I statement here. Take those I statements out. What type of infections? Okay, so a good substitute for I and we and you is using one. The thing about using one is sometimes using oneself, that phrase oneself is a little bit weird and choppy, but trying to think of an example. When preventing healthcare-acquired infections, it is important to realize what type of infections one is preventing. So this sentence could have been saved had it just said one. Maybe the student didn't know. And of course, here we have, according to the authors of patientcarelink.org, this is kind of not a big no-no, but you would just say, according to the literature, urinary tract infections make up 32% of healthcare-acquired infections. So we don't exactly list websites out, especially whenever we are writing papers. It's just kind of, we're searching through literature, and you are the one to reference it at the end, not in text. Oh, this is a statement made, and anytime I see something like this, anytime Dr. Garrett sees something like this, it's a statement that has been verified by somebody, some way, somehow, and you have to cite where you got this, because if not, you're just blowing me some smoke. So the most common hospital-acquired infection would be urinary tract infections, followed closely by surgical site infections. Great statement. However, who comes up with that? Did you think of that? Did science say that? So that's where you would do an in-text citation, like right here. Let's see. This right here, healthcare-acquired infections, this is not the author. The author would go here, which I believe is CDC. And then when we look at your reference page, that's where we would see the title of the document was Healthcare-Acquired Infections. This person had a little c. It's a big one. I think the CDC has changed its name, Center for Disease Control and Prevention, but they still refer to themselves as CD. As you can see, I made little notes on this person's thing. I guess excessive or redundant words that are kind of extra. You know, this person had a really long sentence, and let me refer to it so I could just read it to you. You have to read your sentences out loud, and then you can really see how long they are. So, because I read your papers out loud, and so will Dr. Garrett. In the attempt to reduce the number of infections, the Center for Disease Control has released hand-washing charts that are in schools, hospitals, and even some public restaurants. And it is designed to promote proper hand hygiene and prevent diseases from spreading through the community. Whew, that's a lot. That's too much of a mouthful. And so what I did is I gave the student an example, and I took what they said here, and I made it short, sweet, simple, and I took out, and that will get you in trouble every time for having a run-on sentence. A lot of times if you just redesign your first sentence, you'll be good. So here's the new one. In the attempt to reduce the number of infections, the Center for Disease Control has released hand-washing charts that promote hand hygiene and prevent diseases in schools, hospitals, and even some public restaurants, period. So, and you honestly didn't even need through the community to get your point across. Let's see. Vague pronoun usage. It's hard for me to, and anybody who's reading in general, to figure out one from the other. When you have two parties in a sentence and then you use a pronoun. So for instance, when a visitor comes to visit, and that's a redundant term, visitor and visit, I would probably change visit. Or when a person comes to visit, or you could say when a visitor comes to the hospital, but I'll use what this student has here. When a visitor comes to visit a family member or a friend in the hospital, they are exposed to a wide variety of diseases and bacteria. So which they are we talking about? Are we talking about the visitor, or are we talking about the family member? So whenever you use pronouns, I'm not saying you can't, just make sure you specify who you're talking about. So this could have changed very easily to when a visitor comes to the hospital to visit a family member or a friend in the hospital, the patient is exposed to a wide variety of diseases or bacteria. Or if you're talking about both of them, you can say both are exposed to a wide variety of diseases and bacteria. So watch your pronoun usage. This student had an example, but a lot of everybody, in fact, if not everybody, had some interesting pronouns that were just kind of hanging out there that I wasn't really sure what they were talking about. Here we are, another using figures of speech. So make sure they are following all the guidelines and are not cutting corners. Once again, if you are literal like you should be in scientific writing, I see somebody with a pair of scissors like cutting corners off of something. We know in America that we're talking about taking shortcuts and not following protocol. However, when you're writing, this needs to say, and even fellow colleagues, to make sure they are following all the guidelines and are not breaking protocol. So some of you might start arguing, but breaking is not really figurative, but you know what I'm saying. Breaking protocol, or you could say not following protocol. Healthcare providers must also look after what they are coming in contact with, because some surfaces may look clean, but they may be crawling with infection. So crawling, we're thinking of surfaces crawling. Surfaces don't crawl, but they may be, I can't even say carrying infection. You might be unsanitized. You know, that would be another word, because that is exactly what you're saying. This down here, then we would have better turnout for patient safety. Outcomes. Outcomes is the buzzword. It really is. You'll hear outcomes. You'll get outcome death. So, let's see what we're looking here. References, file toth. Okay, so whenever you actually do the place of the, the place of where it was published is supposedly a book. However, we don't have anything like first edition, second edition, or even, I'm not even sure who were is, if that's the manufacturer. So this looks halfway done. We would have to refer to our in-text citations, which I believe is on page, I have it here, my list. I think it's on page like 176. That's where it starts to, it's when it starts talking about in your APA book how to cite, how to do a reference page. Once again, patientcarelink.org. This is the author of this article, Healthcare Acquired Infections. And just to throw it out there, there are two acceptable ways to say healthcare. Some people just say healthcare that way, and some hyphenate it. If you hyphenate it, that's fine. It wouldn't look like this. It wouldn't have a capital C. It would be a lower C. Just FYI. Okay. That's what I have on that one. Okay, so here is another student's paper that I was going to show you guys and hopefully give you a better understanding about how to write these papers. So immediately I could see, once again, as I mentioned earlier, there's nothing that says running head up there. I am happy it's in all caps, but yep, don't have running head, and there's no page number. And you can't tell up close, so you may want to zoom out, but I can tell that's in the lower to center of the page. Remember, upper third. So if I could, can't even get my cursor up there, can I? Huh, it's blocked off. Okay, well, oh well. Let me undo that. Okay. Note to students, Dr. Garrett likes titles. Use them. If you don't, it makes it harder for her to miss your paragraph that talks about one of the, I guess, pieces of the directions. So if you use titles, make sure you have the correct heading selection, and I think that's somewhere in your APA book of how the different levels of headings. This one is appropriate. It doesn't need to be bolded. It's in the center. However, sometimes whenever you have like two subsections under this, it'll have to be actually to the left, and then like another subsection would be left but bolded. So there's different levels of headings. This one is called a heading 1, and it's appropriate. However, I probably wouldn't separate it. I would have it just be like that, or as much as it would kind of go up and fit on that line. Space, and then after your heading, you always want to have a space. So the thing about this is I'm not sure what the APA book says on this. I don't remember anything. However, I don't think it would be a good idea to use an abbreviation in your title. Introduce HAIs, abbreviations, somewhere in your text. Okay, let's talk about this paper. So right up front, we have a quote, or not so much a quote, but a fact from the CDC. It is preferred and best and recommended to not start with a fact. You're supposed to lead into it, something simple. In fact, you may even want to say infection prevention saves lives. Like just that kind of thing is recommended. And to start with a fact is kind of frowned upon in an APA world. So start with a statement. Here I see CDC Gov. It would actually need to be all spelled out. In fact, I'll just show you guys what this should look like. Center for Disease Control. That. And if you want to then, every single time you have to reference CDC, this is how you do it. You do a bracket. Oops, it's not a bracket. You do CDC. Oops. Closing bracket. So the next time the student says CDC, they don't have to spell out Center for Disease Control. They can just say CDC 2015. So that's how you do that. So not only do you have to introduce abbreviations first in your text, you also have to introduce abbreviations into your in-text citations like I just did. So use the brackets if you have a really long title of some organization, whatever. Okay. Here we have, remember how I mentioned you can say healthcare in kind of two different ways? So here this person said healthcare, they separated it out, and here it's healthcare, and I think for the rest of the paragraph and even the rest of the paper, they kept it as one word. So whatever you do, it's supposed to be hyphenated. Keep it together and keep it consistent. That person is keeping it together, so I'm going to do that too. Let's see. Okay, this one statement, patients with HAIs end up with hospital admissions. What's another better way to say ended up? If you think for a second, you may come up with results in increased. Patients with HAIs result in increased hospital admission resulted, I think it's resulted in increased, look at me, I'm messing it up now. Sometimes I will work on students' papers and continue to try to reword their sentence so much that I want to make it work. Let me just go back and say this. Ended up with is, once again, something I would say in conversation. However, it's better to say patients with HAIs result in 2.5 times longer hospital admissions and incur higher total health care costs than patients who did not acquire HAIs. So this, by the way, is a very good citation. We have no punctuation prior to it. Rowley, Claire, Ruffle, comma, and it's really supposed to be this and symbol, not and. So use that. You've got a comma, the year, and then your punctuation is on the outside. Even if you have a question mark, it's okay to put it on the outside. It should be afterward. What you don't want is this, just nothing. Let's see. Oh, this one here. Right here, patients suffer increased stress from loss of income, loss of interaction, potential for other complications, and their unknown health outcome. Oop, hold on a second. Hey. Oh, hang on. All right, let me pause this. If I can find it. Okay, sorry about that. My mom just came in the house. So anyway, back to this statement. I'm sorry, I lost my place. So patients suffer increased stress from loss of income, loss of interaction, potential for other complications, and their unknown health outcome. I'm actually going to veer on the side of this is an incomplete sentence. Only because prior to that, we started talking about getting infections, and then here, to change the sentence and to make it more complete, I would say patients can also suffer negative outcomes such as increased stress from loss of income. So that would rescue this sentence and make it complete. Another thing is this is a fact, or at least it's stated as a fact, and it needs to be cited. Otherwise, that means you just came up with this in your head, which I know you did it. It's not because you're not smart, but this is not one of those common sense statements. This is kind of something that's been proven and tested. That's why you're saying it. We just need to cite it. If not, it leaves you in the liability for saying that you're plagiarizing, which I know this student is not. It's just a matter of they probably didn't know that this is something they should cite. Excuse me. Okay. I thought this was kind of funny. This is like a little pun. Healthcare personnel and family members are not immune to issues caused by poor infection prevention. Immune, infection prevention. So probably not intentional. However, try to make sure that you stay away from little things that can be considered puns, which is, gosh, what's the definition of pun? Oh, anyway, I can't get anything to come to my mind that doesn't sound stupid. So, try to stay away from little things like that. Another incomplete sentence here is increased workload due to sicker patients and having to take sick days due to illnesses from improper hand washing. A lot of due-tos. If we took out some of those, the sentence probably could work. Increased workload leads to sicker patients and having, like, what, the nurses have to take sick days because of illnesses from improper hand washing. So watch your sentences, and this person isn't the only one, it's just a prime example, but watch your sentences and make sure it is logical and that you have kind of a beginning and an end and a purpose to it. So let's see what else I have here. Oh, I know it sounds like I'm telling everybody the things wrong with their papers. There's a lot of things right. Here's another statement that's actually pretty awesome. Besides extended hospitalization, increased medical costs resulting from HAIs, family members face many additional issues. That's a great transition sentence that this student did. Kudos. So I promise there are a lot of good things in this paper. I'm just not pointing them out right now for time's sake because I know I'm going extremely long. So, here's an example of a topic sentence not following and matching the rest of the paragraph. I understand how a lot of times you take the directions and you make them, like you break up the directions of an assignment and each segment is the start of a new paragraph. However, in this case, there is a mismatch between your topic sentence and the rest of the paragraph. Just to summarize, the rest of this paragraph talks about education and staff. However, the first statement really doesn't talk very strongly about education, such as prevention of HAIs. HAIs can be accomplished by using aseptic techniques, increasing awareness, and reducing infection rates, which was my directions. However, the rest of the paragraph talks about education. So if we were to say something along the lines of using the assignment directions for your topic statement here, your topic sentence, make sure it relates, and I think we could say this by saying prevention of HAIs can be accomplished by educating nurses on how to use aseptic techniques, increase awareness, and reduce infection rates. So now I know we're going to talk about education, which is what the rest of this paragraph says. Great example. Where is it? Oh, anybody knows that we're missing page numbers? Gotta have page numbers. Oops. Okay. There's one thing I want to say. This was good. Uses aseptic non-touch technique, and here they used abbreviation. However, I noticed that AANT was not used nowhere. It's not used anywhere else. So if you are planning to use an abbreviation or a word elsewhere, that's when you abbreviate. In this case, this is the first and only time the student mentions AANT, so you really don't need it because that's what the purpose of abbreviation is. So sometimes you got to watch yourself whenever you use an abbreviation. Sometimes you ended up mixing the way that it's pronounced. Officially, it's supposed to be catheter-associated urinary tract infections, which is what CAUTI stands for. So we've got an extra word here. There we go. Catheter-associated urinary tract infections. So read these sentences out loud to yourself. A lot of times you can say, wow, there's like 2 words that are very, very similar, like urinary catheter associated urinary tract infections. Gotta read your sentences out loud. It will save you time and time again. Okay. Another error many people have is making sure you're consistent with your plural and singular nouns. So there are many different tasks and intervention that are used to help. It should be interventions. If you want to say intervention, make sure this just says task and not task. But it obviously would be better if it said task and interventions that are helpful. All right, and here we have another phrase that has no backing to it. There's no reference. But the 2 most important are knowledge and proper hand washing. According to who? Put that person, whoever tested that, right here. I have redundant words here. And count 1, 2, 3. Maybe 2 times should a word repeat itself in a paragraph, a descriptive word. Oops, oh man. Maybe 2 times. However, 3, it's getting a little too much. So whenever you do your descriptive words or otherwise adverbs and adjectives, make sure you don't have too many of the same things. Because then it's just simple, simple, simple. This person just had a really good example, but a lot of students did this as well. Then, the whole paper, nobody mentioned we, and I was about to give the student kudos to it. However, it says right here, this is why we ask our coworkers, patients, families to remind us when we forget something. No, you're doing so good. So, you know now, stay away from we, I, our, you, should, that kind of thing. A lot of students said, you should, blah, blah, blah. But, okay. Let's see if I have any comments on the reference page. References, yes, do have a page number here. Yep, here we go. Always spell out. Oh, well, what is here? Updated citations and bibliography. Okay. Don't really know how this came about. Okay. That must be a Word plugin. Never really seen that before. But anyway, this needs to be spelled out. Center for Disease Control. We really don't need to have in here just abbreviations. And on that note, I would even include, so you've got, oops. Gosh. And this is again where you put your brackets. CDC. Obviously it would be italicized. Okay, and then the name of the document would be data and statistics. I wouldn't use this. I would have to double check my book again, but something like a period to separate your author from the actual title of the document, whatever you're trying to use. And then here, this is good, retrieve September, blah, blah, blah. These need to be the same color. I don't know if you can notice, but this is grayed out because it's hyperlinked. Make sure you undo that hyperlink. Some way, somehow, I think if you were just to highlight it, let's see if it'll let me. Undo, yeah, remove hyperlink. And then go back and make sure it's black like the rest of everything. Dr. Garrett's picky. Gotta do what she wants. For whatever reason, when this printed from the student, I didn't have your last name, FM year, article, journal title. It actually says Rowley and Unsworth, who they mentioned earlier. I must have activated something and then messed it up. But anyway, all right, let me go back to my list, and I'm going to review with you guys one more time of what the do's and don'ts are. now that I've given you some example. I'm sorry, I know this video is long, however, this is honestly like a one-on-one coaching I'm doing with you. So, informal use of words. I think I've given you enough examples. Make sure you use more technical terms that really define what you're trying to say. It's not good, it's not great, it's not some, or no, some is okay to use. Just those adjectives and adverbs. Oh, big, big. Don't say big. Use significant or primary or major. Those are way better to use. Watch for run-on sentences or common splices. In fact, if you've got two separate ideas or you feel that you're running out of breath whenever you're reading a sentence, because you guys are going to read your sentences out loud, right? Right. Of course, you're saying yes. Read them out loud, and if you feel that there's two separate ideas, you might as well just split it up. Or you need to use a semicolon. Watch for redundant terms, such as, as we saw in the example, using simple over and over again. Redundant terms was pretty prevalent. Now, for your title page, you only need those three things that I talked about earlier. They need to be in the upper third, and your title cannot be, I think, any longer. Gosh, I don't know why I'm drawing a blank. It's either 14 or 21, but Garrett likes it shorter. Shorter is better. And if you're going to use titles throughout your paragraph, throughout your paper, which you should, make sure they're in the center, they're short, and they're not bolded. No bold. Look at your headings in your APA book. Whenever you use a header, they need to be over to the left. The first page should say running head, and the rest of the words all need to be capitalized. Always page number as well on every single page. Let's see. If you are presenting something as a fact, you need to put where you pulled that fact from. There's something called as cited by. Like, for instance, you read an article and then they quote the CDC. Officially, you are supposed to go to that person's source, such as that article who cited the CDC, and you're supposed to go to the CDC, find that, and then cite the primary source. However, in my experience, sometimes I cannot always get to the primary source. So I'm reading an article and it mentions another article, and for whatever reason, UWF, the databases that they've chosen for articles, does not provide access to this other article that is the primary source of that information. Only then are you supposed to say, as cited by, and that's in that article you found. So, I don't know if you've ever heard, in your literature classes, you're supposed to use primary sources, and then if you cannot get a hold of the primary source, you can use the secondary source, and that's when you say, as cited by so-and-so. So, if you need clarification on what I'm talking about, you can post something to the discussion page in PCC1, and I'll define that a little bit better for you. But primary sources, and then if you have to use a secondary source, such as an article quotes somebody else, then use as cited by so-and-so. Okay. Gotta back up our statements that are facts, because if not, we're just blogging and it's totally opinion based. Don't need that. In fact, make sure you leave your opinions out, and things are very scientific. These are the facts. You're presenting your case. If you have incorrect, if I said you had incorrect or missing in-text citations, you really need to look at page 176 to page 79, and it's all about references. Just to give you a little tidbit, I actually, through grad school, and I wish I would have figured it out in undergrad school, used a software system that helped me generate APA format for the reference page and in-text citations. It's called Perla, Perrla. I had to pay for it. It was $40, and I just downloaded it online, but it was the best $40 I spent. It only failed me maybe 5% of the time whenever I cited something and I typed it in wrong. Yeah. I typed something in wrong, and it, the teacher caught it, and she said, where did you, your APA book doesn't say this. I'm like, oh, yeah, you're right. I really went off of this software to generate it for me. And once I looked it back up in the APA book, it was very clear. But this software, Perla, uses APA, MLA, and I think the Chicago method of citing, so you just have to pick the right one. Very user-friendly, and it actually is incorporated into Word. Don't address the reader. Keep it in third person, meaning narrate it. Sound like a textbook. Don't say I, don't say you. Sound like a textbook. Always spell out abbreviations first. Don't use them in the title, preferably. And then you can use the abbreviations the rest of your paper, such as CDC or CLABC or whatever it may be. Watch your pronoun usage. Make sure it matches up. If you say they, make sure you only had one person that you referred to earlier in the sentence versus two separate parties. And then I'm thinking, which they are you talking about? And using this and that. In fact, use them, but use them sparingly. A lot of people used this and that, and I had to sit and think about what you were referring to. That shouldn't happen. You know, some students would say, that shouldn't happen. I'm like, what do you mean that? Like, are you talking about the infection, or that what the nurse did? Like, what is that? Uh-oh. Baby's up. Probably have to go in a second. When it comes to designing your references page, check out page 37 on your APA book. I think that might be it. Oh, don't start a paragraph with a quote. Read your papers out loud. Have other people read your papers. Make sure you pick somebody to read a paper who's good and correcting and has a good foundation of, you know, basically English Comp 101 kind of material. However, just don't say, read my paper and how does it look. Generally, people are very positive and they want to tell you you did a really good job because they know you work really hard and you're in nursing school and you don't have time to do stuff. But what I do is I approach people and I say, find 3 things wrong with this paper. Then they actually do a good job and they critically review your paper, which is what you need. All right. And also, I tell them, whenever I say read my paper and find 3 things wrong, I'll just say 3 things wrong in general, and I also say, I want you to make sure I don't use figures of speech, such as cutting corners or, you know, something falling off the tracks, you know, that kind of, like, we got to keep it on track. You make sure that person who reads your paper looks for that specific problem. Because almost, in fact, 100% of you have done that problem using figurative language. All right, I hope this helps you guys. I'm sorry that it's probably like an hour long now, but I'm going to post it and get it up to you guys, and your papers are coming along. Hope you're having a good weekend. Bye.